Good afternoon. As the HCB Executive Director, I have developed a presentation of the overview and future implications of HCB and am presenting it here to the Board of Directors on December the 9th, 2020. The goals of this presentation are to summarize external factors impacting HCB, present a SWOT analysis, explain proposed strategies and tactics to promote organizational success of HCB for the next 3 to 5 years. This was accomplished by using systems thinking, situational analysis, strategic planning, organizational/mission and vision development, budgeting, constituent engagement, and evidence-based decision-making. Healthy Community Brookfield is a nonprofit organization started in 1998 to focus on public health and wellness of Brookfield County. HCB offers programs collaborating with the county and state in order to increase public health in the community and promote health and wellness services. As the HCB organization structure has changed over the years, there has been a disconnect between the programming, organization members/board of directors, and the needs of the community. The programs and services HCB facilitates include vaccine services, health and wellness for schools, well water testing and mitigation, after-school programs, diabetes education, smoking cessation, violence prevention, and case management for elderly after hospitalizations, employee health and wellness, mobile health services, prenatal newborn care, and women's health primary care services. Environmental influence of HCB. We are now just starting to implement proper financial planning. Our programs rely only on grants and budget allocations, which make them at risk for being cut. Funding through the health department might be cut due to not meeting the 9 standards. If they are cut, the administrative staff responsible for them will need to be terminated. Local accreditation of health department requirements were not met, which was the 9 standards. So the prenatal and newborn care, smoking, and immunization programs funding are at jeopardy. Political. Staff are adjusting to my new position and the changes we are making. Our board chairman is also relatively new as he has only been in this position for 6 months. COVID is putting an extensive pressure on the organization as well as staff members from a professional and personal standpoint. Programming is not prioritized on what our community actually needs. The board of directors and management believe that the ultimate goal is grant funds, even if it does not align with the mission of HCB, reflecting that any money is better than no money. Community relations. Community members believe HCB is a good organization, but many do not know what the organization actually accomplishes, believes board members are dedicated and knowledgeable. The consensus in the community is that they believe that HCB is still affiliated with the VNA or is a part of the hospital and health department, creating a positive image that may or may not be false and confusion regarding programs and services we offer. Stakeholders question the mission and vision of the organization and the programming strategies we use, and they also think we might duplicate programs. County officials are frustrated by the demands of our increased funding every year. SWOT analysis. Strengths. Provide contracted public programs to increase wellness in the county. New executive director is experienced and is planning to implement positive changes and review the organization. Adequate upper management such as board of directors, nursing director, quality improvement director, and education director, and we are a freestanding agency. Weaknesses. Community members are unaware of how HCB is structured and what it accomplishes. Health promotion and social determinants are not a focus of our programs. Programming is based on perceived needs and interest of employees. Unstable employment opportunities reliant on programming funding that is not reliable. Opportunities. Allocate more resources and focus toward health promotion and broad issues. Educate community regarding affiliations and clarify programming and services as a standalone organization. Change programming and funding efforts to reflect mission and needs of community. Threats. Programs are contingent upon grant funding and budget allocations. Local accreditation of health department's requirements were not met, putting funding for several programs at risk. Stakeholders question the mission of the organization. Stakeholders question programming. There is some duplication. Needs of the community is not a priority. HCB's current mission is, as a nonprofit organization, Healthy Community Brookfield strives to improve the community's health by strengthening the quality and performance of health promotion and wellness practices through outreach, provision of services, and ongoing education. The new and updated mission that I have created is working to achieve improved health and health equity through health promotion, wellness practices, via outreach, service programs, and continuous education. HCB's current mission statement is due to be updated. HCB's current vision statement is, as a nonprofit organization, Healthy Community Brookfield promotes healthy practices which can lead to improved health behaviors, healthier individuals, and healthier communities. The updated vision that I have proposed here today is, as a nonprofit organization, we strive to promote healthy practices through knowledge and access to care which will lead to improved health behaviors, healthier individuals, communities, and create health equity, prevention, and disparity reduction. Strategies include financial, which would be create, plan, and detailed budget, increase stability of funding, program ratification, which reflect community needs and incorporate collaboration, staff development, which would change structure and educate staff, community involvement, which would involve education. Action plan. The financial plan will be developed and maintained by the CFO, work with managers of the programs, and this will start immediately. We need to develop a strategic plan based on actual community needs, restructure program funding, allocate more resources, and focus toward health promotion and broad issues, fundraise through hiring and creating a fundraising position, apply for more federal and state grants, collaborate with other organizations to expand services without need for more funds, which also provides publicity. Barriers to this can include COVID-19 and limited access of funds. Staff development will be initiated by Human Resources and Education Director, and we would aim to create the plan by the end of 2020. Create stability by change staffing structure to move away from relying on funding for specific programming. We would want to create fluidity so staff can be cross-trained and work in multiple areas if certain programs do not need as much support during certain times. Educate the staff, including board members and management, on what our community needs are and how to determine this and create/implement programming based on our needs of the community. Barriers to this could include resistance of change, of new positions, creation of new job responsibilities, and expanding areas of comfort zones for employees. Program ratification will encompass many departments, including program managers, quality improvement director, and nursing director. We want to start this assessment in the new year and create the plan in the first half of 2021 and implement after that. This will be continually evolving based on community needs and status of different programs. We want to change programming and funding efforts to reflect the mission and vision and needs of the community, immediately create and implement a comprehensive quality improvement plan that uses an organizing framework like a plan, do, check, act for complete integration of quality improvement and performance management initiatives into our operations. This framework provides structure for staff to focus on specific programs and test changes that are trying to be made. We want to determine collaborative opportunities with other organizations to expand services offered and combine efforts around specific goals. We would like to do community health needs assessment. Barriers to this include conducting research to determine needs of community, lack of interest in other organizations, lack of funding for new programs, and little participation of the community. Community involvement will be handled by public relations director and community outreach workers, and this will start in the new year. We want to educate community regarding affiliations and clarify programming and services as a standalone organization, utilize new mission and vision value statements and goal development to educate the public, employees, and key stakeholders. Barriers to this include COVID-19. People are worrying about their well-being right now and not necessarily paying attention to our programs, and also not reaching certain demographics such as the elderly. These 4 goals contribute to development of a strategic plan that is based on needs of HCB, the community, as well as evidence-based practices that will result in positive changes for our community. Evaluation. Continual community health needs assessments. We want to identify community health needs and existing gaps in services, strengthen relationships with community partners to improve local health care delivery, and share this information with the public. Conduct staff surveys to get feedback from who's providing care and implementing these changes. Community surveys to see what the public thinks. Impact evaluation. Assess the efficacy and effectiveness of interventions in terms of intended and unattended health, social, and economic outcomes. Program evaluation, which involves assessment of the processes and outcomes of a program with the intent of furthering the improvement, including economic outcomes. Being new to HCB, I am looking to provide a fresh start to our programs and staff in order to meet the changing needs of our community. I'm looking forward to involving the Board of Directors in making these changes for HCB. I'm eager to incorporate your feedback and suggestions into the action plan and welcome your questions at this current time.